Or how are we doing actually on the productivity of the workforce, both the physicians and the staff? This is tracked every day by the cell leads or the flow coordinators. And then there's huddles. The staff get around this board and they actually look at, okay, how did we do today? What do we need to do to change things so that we can improve the delivery of care for the patients tomorrow? And it's a way to really understand how we're doing for the patients. Are we providing a better quality, lower cost experience for the patient or not?
In these colors, you can see red, blue, light blue, purple. What do the color codes mean?
So if it's green, it means that it's good to go. It means we're meeting our goals. If it's red, it means it's not. There's a problem. And so then what we do is we actually we have problem-solving tools. There's a little chart down here, and it's called an actionable item log, where we actually identify the problems, and then we solve the problems using a common problem-solving format that we've created here at ThedaCare. And every staff member actually knows how to do that. It's a one-page problem-solving form that they actually use to solve the problem themselves. It's not like you have to wait till your manager or vice president says it's okay. If there's a problem, those folks are at it, solving it right now for the patient.
And that's what we would see in a Toyota manufacturing plant?
Absolutely. We stole it from Toyota, that's why I know that.
Fascinating, fascinating. I wish I got as good a care as my Forerunner gets. We're here in one of ThedaCare's 23 primary care facilities. This is Nancy Van Sandbeek. She's the flow facilitator. Nancy, how does the process work?
Well, what happens is the patient calls in the morning to get their appointment. What we do is when they are on the phone, we ask them, would you like to be seen today? That's one of our biggest things. And if they say yes, we look and see where we can get them in the schedule for the day. So then what happens on the back end, as soon as they get scheduled, what happens is we have someone working on the back end doing all their, confirming all their registration, their phone number, their insurance. So when they come in, it's really a process of just saying their appointment time and coming in. So then what we do is they get put in, and one of the things that us flow facilitators do is we look at that chart the night before of what's for the next day. And what we do is we look at their chronic diseases. So are they a diabetic? Do they have hypertension? Do they have hyperlipidemia? And then what we also do is look what labs are due. Because what we do is pen those labs for the patient because their labs are drawn when the patient comes into the clinic. So we get that all ready for the provider. We get all the diagnoses ready. We put in, if it's a physical appointment, we put that in the appointment. And then what happens is the patient arrives the next day. They walk into our clinic and it's just, hi, my name is so-and-so and I'm here for my appointment. Have a seat. And then they arrive. The MA goes out to get them, brings them back in the room. They get their blood drawn right away. And then the blood then gets immediately to the lab. While the MA finishes rooming that patient, the blood is being processed. When that is finished, then what happens is the doctor is waiting to get in the room. Once the MA finishes, The results print on the printer. We clip them outside the door. If the provider happens to be in there, we slide it under the door. The provider then sees the patient. They give them their lab results. And then what happens is they do a plan of care. It's their personal plan of care. So the provider goes through their labs, adjusts any medications, goes through what's expected of the patient, what's next in line, and sets up the follow-up appointment, sends any medications, faxes them over to the pharmacy. And then the MA goes in, the after visit summary prints, the MA goes in, makes any follow-up appointments, gets any labs ready for the next time, and the patient walks out with their lab results, their meds faxed, and a complete plan of care.
Thank you.
It's improved the timeliness of care. It's improved the accuracy of the chart, medications. It's respectful of the patient's time. In most places, if you have a chronic disease such as diabetes or something like that, and you want labs done, they will either have you come in 2 or 3 days early to get your labs drawn, and you come back for the visit, at which time then the patient and the doctor get to discuss the labs. But in the current process, we anticipate your needs before you arrive. You know to come in fasting if that's necessary. You get your labs drawn at the beginning of the visit. That goes back to the lab where they're working on the specimen. Your blood pressure gets taken. Then you and I do the usual things. You know, I ask questions, I examine you, the labs come back, we discuss the results, and then you leave here with a plan of care and all your questions answered. And the old way of doing things, there might be things that were still floating out there that were unanswered questions, and then we would get into the well, I'd like to put you on a medication for cholesterol, for example, and then the nurses would be making the phone call, and then when they could finally reach you, because they might get voicemail, they might find you, you know, you're at work, it might take us a while to find you, and then your answer back is, well, I don't want to do that, I'd really rather do something else. In the world that we're living in here, that conversation occurs at the visit, and if there's a negotiation process, it's all done by the time you leave. And then you have a full understanding of what the expectation is between now and the next visit, and we have a full expectation of what we're planning on doing at the next visit.
Dr. Moore, in your 21 years as a doctor, does ThedaCare work the best? Is it the most efficient, giving the best care? I
believe it is. I really think that this is one of the best offices in the world that I could possibly be working in. We have a very high quality of care here. It feels good to be satisfying patients and doing it a little bit better than anybody else, in our opinion. And it has allowed me also to get home in a more timely manner. A lot of the work is finished when I leave. You know, there's not stuff kind of waiting for the end of the day, and then I have to go back and do a lot of dictation and things like that.
I spoke to a patient here, and she told me that she felt like the care was more personal, and it meant a lot to her. How does that make you feel?
That makes me feel good. I listened to that, and I heard her say that in the past we used to be rushed. It's challenging in a primary care office not to be rushed. But again, we had process engineers come through the office and help us put everybody's work at the right level. So stuff that I don't really need to be doing as the doctor that doesn't require an MD degree, I don't really do much of. And that's allowed me to have more face time with the patient, which is what they want in the first place. So I'm a little less stressed that way. Everybody's job had to change. We have more people drawing blood than we used to. The person that's running the labs is pretty much just running the labs and turning them around quickly, rather than being the one that draws everybody's blood in the clinic and have to run the lab machine. So all of the processes that we have here are about as efficient as they can be. And the result is something that's very satisfactory to everybody. The physicians that are providing the care, the patient, the payer.
Dr. Moore, thank you.
Yep.
Good luck.
Thanks.
So you've seen this collaboration between these professionals, and what's happened is we've taken all of the waste out of the process. We're not waiting for things anymore. Doctors and pharmacists are actually talking together. The nurses are talking together, and that's why we've been able to reduce the total cost by 25%, because it doesn't require the usual fragmentation that we see is completely gone, and now it's really what we call sort of continuous flow for the patient. All the information's flowing. The professional's information is flowing you know, between them, and we've taken the waste out of the system.
And you learned this from Toyota.
Yes.
Amazing. While ThedaCare is unique to Wisconsin, programs in 14 other states had similar success applying the same principles. Major institutions like Johns Hopkins University and UCLA have implemented programs just like it.